Hi, I'm Robert McMullen. I'm a psychiatrist who's been a psychopharmacologist for over 30 years, and now I also specialize in doing TMS, transcranial magnetic stimulation. And I'd like to say a few words about ketamine. Ketamine is very popular, and many people want to try it, but it's not a high rate of response. Now, ketamine is called horse tranquilizer, and it's been used by young people who call it Special K. And one can obtain it somewhat inexpensively through some veterinary source because it's used so much as some type of anesthesia for animals. Now, the mechanism by which it works is different than anything else we have, and it turns out that when you give people with treatment-resistant depression ketamine IV, some of them have a very dramatic response. And I've heard of people that within an hour, they say, I feel normal. The first time I felt normal in 20 or 30 years. And with some of these people, it's like setting a reset button. And apparently, the benefit can sometimes last a while, days or longer. However, it seems like most of the time, people are going to need maintenance treatment and have to have a treatment every few days or once a week, and that's time-consuming and expensive. It's also been used instead of giving an IV. IV is the strongest way because you're giving a big bolus of it, and it's going to hit the body and the brain all at once. So you're going to have a big effect fast. Now, there's also been studies using it subcutaneously and IM, and also intranasally. When I first learned about using it IM, intramuscularly, I would say 4 or 5 years ago, I used it on a few people. And I didn't get any benefit, but people felt terrible. They got nauseous, and it was an extremely unpleasant experience. And then I learned how to do it intranasally, and that way you have just like an intranasal corticosteroid spray for sinusitis. You have a spray, but it's a spray of ketamine, and you inhale, say, 2 puffs in each nostril. And I've done this on quite a few people, and I haven't had any home runs, but I've had a couple of people who it did help. And one person used it every 3rd day for a while. It would make him feel a little ill and nauseous, so he would do it in the evening, and then for the next couple of days he would feel significantly better. His depression was not so terrible. He was like 80% of normal, but it would bring him to like 95% normal. And there's another fellow who I believe he switched to another psychiatrist, I think, on his plan, but I believe he's still taking it, and he takes it every 3rd day or so. And it also is something that just brings him the rest of the way up. The medicines he's on have been working quite well, but not quite 100%, and this brings him closer to 100%. So I think it's worthwhile trying when everything else has failed, although you have a much higher chance that you're going to get a good response from TMS, because TMS, if you do 30 treatments or a few more than that, you've got a maybe 50% chance of coming all the way to normal. And it's very unlikely that the ketamine is going to bring you all the way to normal, and then you're probably going to need maintenance treatment. And then many of the people that are getting maintenance treatment with ketamine, after a while, the maintenance treatment is pooping out and it's not working so well. So it hasn't ended up being a good long-term treatment. And they are searching now for some compounds that would have a similar effect, but that could just be taken like a regular medicine.
So without the hallucinations
and also without the hallucinogenic feeling one has with it. I don't believe people usually hallucinate with it, but they feel as if they're about to, and they really feel high in the sense of somebody who's using some recreational drug, although it doesn't sound like a particularly pleasant high usually.
Thank you very much, Doctor.